In for Snally all this week. It's great to have you along. Going to play Kool and the Gang and ABBA for you very soon. Now, I'm talking to the ladies of the audience now. Girls, would you say you are breast savvy? Well, if you're not, there's a roadshow of science, media and art with information about the importance of breast screening, and it's coming your way. Dr. Simon Abrams is a GP at Great Homer Street Medical Centre and involved in the roadshow and joins me now. Morning, Doctor.
Good morning. Good morning.
Simon, we always have a go at you chaps for not checking yourselves over, but do you find that women are just as bad?
No, to be honest, no, I don't think so. I do hear many women who do check themselves, and I think that they are reasonably good at it and do think about it a lot more than us men who completely ignore it.
Yeah, absolutely. Now, tell us about this roadshow. It started last year. How did it go?
So it started last year. It's still going. We've got sessions coming up quite soon. I think we're at Great Homer Street Market on Saturday, and there's other ones around the city, including at the hospitals in the lobbies. So we're very keen that we can attract women who are due their breast screening, which is from the ages of 45 to 70. That's the important age group. We want women to attend their breast screening appointments because, unfortunately, in this city, the levels of attendance are not great. They're particularly low in the area of Liverpool I work in, Anfield and Everton.
But there's a terrible myth about breast screening, about it being incredibly painful. And I, for one, have had breast screening, and I, for one, can say it's blooming not. And the first time I went, there was they did kind of early calls within COVID. I live on the Wirral, and went for and I kid you not, Simon, and I'm not saying this to try and encourage anybody else to do it. When it was done, I kind of went, "Is that it?" I was expecting it to really hurt, and it didn't. And I think that is a real problem, isn't it?
I agree with you, and I think that's what we did a little bit of insight work. We went around interviewing women about what their concerns were about going for breast screening, and certainly there was one of those concerns was about the actual screening process and various aspects of it, like pain, as you say, embarrassment, just not liking to get undressed and have this test. Now, I spoke to somebody recently who absolutely echoed what you've just said, and they said they were amazed at how quick it was. They said it took them longer to walk to the breast screening unit than it did to have the investigation, which took just a few minutes, 4 x-rays. This person said that how nice the staff were, how pleasant and patient and thoughtful, how they just chatted away to them like it was a normal everyday experience for them, which of course it is. Obviously it's not for the women who are going, but they were very good at putting her at ease. And she walked out and said, "Gosh, that was quick and painless."
And it's just so important. When I went, the lady who was doing the screening for me, we were just chatting whilst I was doing, because you can probably guess I'm quite a chatty person. And she was telling me about the statistic of people who don't turn up for their appointments. And it was staggering and quite scary. And then she said sometimes some people will be called 2 or 3 times, and on the 3rd time, sometimes something's there that wouldn't have been or had have been earlier. And it's so important to go for these screenings. So tell me what happens at the roadshow itself. Is it that you're chatting to people? Do you have the screening facilities there?
Right. So first message is no, we don't have the screening facilities there. The screening is done at Broad Green Hospital. There is a bus that moves around various parts of the northwest, but I'm not sure where it is at the moment. But it does have an awful lot of ground to cover, and I don't think it's going to be in Liverpool for a little while. So it is mainly at Broad Green Hospital. I just want to mention that the whole point of screening is to identify breast cancer early, and that's a tough thing to say, and I really appreciate that. But the reason is very simple. If it's identified early, it's curable, and that's really the sort of it's a very brutal message. I don't mean it to be brutal. It's an important message. That's the case. We are so much better at treating breast cancer than we used to, but still the important thing is to get it identified early and get it treated early. So that's why it's so important. As the screening events, well, they are community events. We usually go in a bit of a gang of a few of us. We usually have a prize draw for a £50 supermarket token, and we just want to talk to people about breast screening, about whether they've been, about whether they'd like us to book their appointment. We can do that when we're at the events. We can actually arrange the appointment. It would be at Broad Green Hospital, and then we want to encourage people to have a think about going, and we do that by having a very relaxed atmosphere. We've got these creatives, these artists who are focusing on this Be Breast Savvy program, which is about stitching boobs and sewing. So it's something that you can come and join in with, and whilst you're doing the stitching, you can just have conversations with women who are there, who are artists, or you can talk to social prescribers. They're people who come along. There are community people who are there, and quite often I'm there as well, and not always, but quite often, and I can deal with concerns that people want to talk about. But we just want to encourage the people of Liverpool, and particularly of Anfield and Everton, to go for their breast screening. If they haven't had their breast screening or they've missed it, it is possible to ring your GP surgery and for it to be rebooked. It's fairly straightforward.
Perfect. And, the great message here is it can be a fun event. I see things about boob bingo, and you mentioned the sewing your own boob. There's a boob pincushion. Ethna Brown, brilliant local TV actor that we know, is on a screen reciting a poem to make it all fun. We talked about the dates that are coming up. So dates and venues coming up. 17th of August, so this Saturday at the Grady. Daisy UK on the Monday, the 2nd of September, Blackburn House Thursday the 19th of September, and the Community Shop on Walton Road on Friday the 4th of October. And you made a really good point. This is about catching things early, seeing if there's anything that needs looking at that can be treated and sorted and obliterated. But the majority of cases, there's nothing to see. There's nothing to see.
And that's it. I mean, that's the other side of it is, the likelihood is that you're going to get the all clear, and that you can go home and forget about it for another 3 years. And so I did the difficult part earlier, but also for the majority of people, it's going to be fine.
Perfect. Thank you so much for talking to us. All the very best. And do take yourself along. And, we said right at the beginning, we're kind of talking to the women of the group here. But you know what? If you're a man who's got an important woman in your life, aged between 45 and 70, it can be your wife, your girlfriend, your fiance, your daughter, your sister, your mother. Speak to them. Tell them to do it. A little bit of peer pressure sometimes helps. So once again, this Saturday at the Grady, 17th of August, you can go along to this Roadshow and find out all about how easy it is